Good morning, everybody. Happy Monday. Welcome to another edition of Tips for Parents of Transgender Kids. I'm Jack Oree. For those of you who are new to my group um, support network for parents of transgender kids or who are watching this on have not had the opportunity to get to know me before, I am a transgender man whose mission in life is to make things easier for the next generation of kids than it was for me. And I coach parents of transgender kids to help them stop stressing about their kids' choices and start building the life, then the relationship with them that they want, an authentic relationship that can last a lifetime. Okay, so this week I want to talk about something really important, and that's how to help your kids with mental health issues. And I want to be clear about this. I'm talking mostly about things like depression and anxiety, not severe mental health issues. If your child has a diagnosis like bipolar disorder or schizophrenia or anything like that, that's something that you will want to talk to your child's therapist about too. And therapists also can help with anxiety and depression, as well as coaching, which can be an adjunct to that kind of thing. Um, and I just want to put that disclaimer out there to let you know that there are lots of people you should be turning to for help and not to just turn to this video. Now, the reason I wanted to talk to you about this today is because I think this is something that can be pretty scary, especially for parents of transgender kids. And the reason that it's so important and so scary is because a lot of us know the statistics. A lot of us know that in our community, unfortunately, the suicide rate for transgender people under the age of 18 is 41% or higher, depending on other factors such as race, ethnicity, and socioeconomic status. All those things can also make a difference. Um, but it's at least 41% do attempt suicide before their 18th birthday. And as a parent, no one wants that to be their child. So it can be pretty scary to think about what's going on with your child. And it may be something that you have been thinking about since they came out to you as transgender, especially because before doing a social transition or a medical transition or whatever type of transition your child has chosen to do, they might have seemed very unhappy, very depressed, or very anxious, and you might not have known what to do about it. So, that all being said, what if your child does seem to be experiencing this kind of mental health issue? What if they do seem to be depressed? What if they do seem to be anxious? What then? The first thing I want to do before getting to some actual tips is to reassure you that if your child is in this situation, it is not your fault. Sometimes parents think that, especially with transgender kids, because there are so many choices that you have to make on their behalf, right? You have to decide whether to go for hormone blockers or not when your child is over old enough. You have to decide who to come out to, what kind of gender expressions you're going to allow your child to have and wear, and all those things. And you may have made mistakes along the way. But I want to let you know that it's more complicated than that. It's not the kind of thing where if you made all the right choices, your child will not have any kind of mental health issue. A lot of times, kids have depression and anxiety for all sorts of reasons, some of which may have to do with being transgender, and some of which may just be general life stuff. Especially if you're dealing with a tween or teen. There might be social stuff going on. There might be academic pressure. There might be all sorts of reasons, and then never to count the biological components to depression, anxiety, and all of those things as well. So it's not your fault if you're thinking that it is. Get that out of the way. You definitely want to process those feelings first. Journaling about them can help. Talking with somebody you trust, like a life coach or a therapist, um, can really help with that. That's something that I talk with my one-on-one clients about is their fear that their mistakes will hurt their children and helping you get through those feelings and to the other side of them. So the other thing is to notice what your specific concerns are. You don't want to put a label on your child. It may not be what they're thinking. It may not be what you think it is. So, Um, you don't want to jump too quickly to saying you seem depressed or you seem anxious. It's better to talk with them about the symptoms. And again, so for anything else, like we've talked about a lot, make sure that this is at a time that's good for both of you. I should have said that at the outset. Let me back up and say that now. So the first step actually, after you've processed your own feelings and maybe written down some specific behaviors that you're concerned about, maybe you've noticed your child is spending a lot of time in their room, or that they seem extra jumpy, or they seem extra irritable, or they just don't seem to be themselves in some way. Write down those specifics. And then the second step is say to your child, hey, there's something important I want to talk to you about. When is a good time for us to do this? And depending on your child, you might want to give them a choice of times instead of that, or say, I have time available this afternoon, tomorrow, after school, or on Saturday. Which one is best? That way, if you have a child who's going to drag their feet and never give you a time that works, or use the timing to not get anything done, you can make sure that that doesn't happen by giving them a range of times. Okay, so once you are at the point where you are having that conversation, what do you do? Again, this is where you will have wanted to have your specific behaviors listed first, so that you know what to talk about. Then you can open the conversation by saying, I've noticed X, Y, and Z, and I'm concerned. You can say, I notice you've been spending a lot of time in your room. I notice you've been sleeping a lot. I notice you don't seem to be talking to your friends very much, whatever the case may be. And then follow that up with something like, sometimes when people feel this way, um, you sometimes when people feel this way, they may be feeling depressed, and then maybe explain a little bit about what that means. Feeling sad, and say, depending on the child's age, you might say feeling sad, feeling like they can't do anything right, feeling like you have very little energy and like there's no point to anything, whatever descriptors you want to use. Or for anxiety, you can say, I notice you've been very jumpy, or whatever the case is. I notice you seem to be nervous about your health a lot, or you seem to be worried a lot about a lot of things that are going on. Um, Sometimes when they act like this, it means that they're dealing with a lot of anxiety and stress, and you can explain what that means if your child doesn't know what it means already. And once you're clear on that and you've done that, the next thing is to ask them, do you think that's what's going on with you? And invite your child to talk with you about what's going on. And that's where those active listening skills come in, right? That we've talked about a lot. You can go back to my other videos if you need more help with active listening, but basically, you're gonna listen non judgmentally to what your kid's saying, focus completely on them, try not to focus on what you're gonna say next, and try not to focus on your own anxiety level about what might be going on with them. Um, and then after they're speaking, you can paraphrase what they said, repeat it back to them, or try to get at the underlying feeling under it by saying something like, that sounds difficult, that sounds frustrating, sounds like you've been angry about a lot of things, sounds like you've been sad about a lot of things, whatever the case may be. Um, and another good thing to do after a child has shared something particularly painful and you've done active listening and they say, yes, that's it, or they don't say anything, ask them, is there anything else you'd like to tell me about that? And kind of invite them to speak more until they feel complete. Um, Once you've done that and you've gotten what the problems are, let's talk about what we can do about these problems. And that's where you can offer suggestions. But it's really important with this kind of thing not to impose your ideas. You might think your child needs to see a coach or a therapist, or you might think your child needs to get rid of this friend that's causing them a lot of anxiety, or you might think maybe your child is not um, flourishing in this school. Maybe it could be something like you might think that you need to talk with the school or change schools or change classes or whatever it is, but you don't want to impose that on them. And then you can say, I have some ideas. What do you think of some of these? And give them some of those ideas, and then use active listening to see what they think. And then the last thing is what to do if you really think your child needs help and they're resistant. And it depends on what the situation is. The only time you really want to impose something against your child's will is if you have reason to think that your child is suicidal or is going to hurt someone else, then you have to intervene. Um, if your child is too young to really know what therapy or coaching is or understand it, then of course you know. With a younger child, you might say, "Let's at the end of the conversation, I'm going to make an appointment with the doctor, and that's what, and I want to talk to the doctor about this too." You could always do that. With a tween or teen, that's a little harder to do. With a teenager, it's really up to them whether they want to seek coaching or therapy, unless again, like I said, unless you think that it's an emergency, in which case you might want to take them to the emergency room or if your child has a therapist, contact the therapist. So that's about it for now. And I look forward to your questions and comments. And again, um, this is a really important topic, and I'm really glad that you're tuning into this today because it does save lives. It is something that's serious and important. It is something that is a problem in our community. But again, I don't want you to worry unduly. I don't want you to blame yourself, and just approach the issue with your child. Talk to them about what you've been seeing. Talk to them about what's going on. Do your best to decide together what to do. And then if you need to make decisions about future treatment or mental health issues or coaching, therapy, all those kinds of things, then do that. I hope this has been helpful, and I hope you have a great Monday, and I will talk to you soon.